Hello, welcome back to the University of Iowa Healthcare Organ Transplant Education. At this part in the process, you've been approved for a transplant, so what comes next? Being approved by the review board is a major step. It does not mean that there is a transplant ready for you. The official transplant waitlist is managed by UNOS, that stands for United Network for Organ Sharing. They maintain the list of all patients waiting for transplant in the United States and organize all the organ offers for waitlisted patients. Once you've made it on the list, it doesn't necessarily mean you'll stay there. These are some things that can help keep you on the list. You need to keep seeing your provider for regular checkups. Oral health is also important. You need to keep seeing your dentist for regular exams. You will also need to come to the transplant clinic regularly for evaluation and ongoing education. Your caregiver will need to come to the clinic with you. There are several reasons a person can be removed from the wait list. Here are some of the reasons for being marked inactive or removed from the transplant list. The most important thing to remember is to communicate with the transplant team throughout the waiting process. When you are waiting for the official transplant call, there are some things to keep the team aware of. You can get the call anytime, day or night. It is okay to go on a trip or vacation, but you will need to let the team know before you go. You will need to give current phone numbers for yourself and your caregivers at all times. The transplant team must be able to contact you in 1 hour. If they cannot, they have to give the organ to some other person. You will need to keep the transplant team informed of any major changes in your life. These can be changes to your health or insurance, if you plan to move, or if you change caregivers. Keeping the team informed will make sure this process goes smoothly. You can be listed at more than one transplant center, near or far. This may increase the chances that you will get a transplant. When the time comes, a transplant nurse coordinator will call you. It could be any time of the day or night. It can be any day of the week. You also may not recognize the number. You need to have a plan in place when you get the call. We suggest you make a list of things to bring to the hospital ahead of time. Your caregiver will need to bring you, so plan for this in advance. Have arrangements made for child or pet care. You will need to be able to leave your home within 1 to 2 hours, preferably sooner, after you receive the call. You will need to bring your insurance information and a current medication list. In addition, you will have a planning for transplant form. Please keep this form up to date. The transplant nurse coordinator will give you instructions on where to report at the hospital. As we end this video, we want to share the program's contact information. Please reach out if you have any questions. This process will not go on without your consent, and remember, the transplant team is here for you.